Getting older is a part of life, but you don't have to deal with the uncomfortable parts of aging. The American Urological Association reports that half of men by the age of 60 will suffer from a condition called BPH. But the good news is, it's easily treatable. Board-certified urologist Dr. Scott Simon is joining us to explain what BPH is and the latest advancement in technology that can help. Welcome, Doctor.
Thank you for having me, Laura. Pleasure to be here.
Doctor, first, what is BPH and how common is it?
BPH is just enlargement of the prostate, which is non-cancerous. It's very, very common. Happens to almost every male as he gets older. The prostate sits right underneath the bladder, and as it starts to grow, it pinches off the urethra, making it harder for a man to empty his bladder. And by doing that, it starts to cause a lot of symptoms like really weak stream, going all night, going real frequently, going real urgently. It could be a real nuisance.
Until recently, there were a variety of treatment options, not all with the most desirable outcomes. Tell us about them.
For years, we used medications and a procedure called a TURP to take care of these problems. They can be associated with some side effects, sexual side effects, so being a big one that men don't like. And the TURP requires a hospitalization and anesthesia.
Tell us about this new minimally invasive treatment called Rezum.
Yeah, Rezum is one of the newer minimally invasive ablative procedures where we steam the prostate. And by steaming it, we get the prostate to shrink over time. We put a scope into the urethra. We then inject steam into multiple locations within the prostate, each blast lasting 9 seconds worth of steam. Over time, this causes those cells to die, and they'll essentially reabsorb, and it will reopen the channel over time, which will improve your urine symptoms. The procedure was approved by the FDA in 2015 and is currently included in the American Urological Association guidelines for treatment of enlarged prostate. Medications are really just a Band-Aid to the problem, whereas Rezum actually will treat the problem, the underlying issue of the blockage.
I know you said it was quick, but is it relatively painless?
This is a quick 5-minute office procedure. I tell patients not the most fun you're going to ever have, but this 5 minutes will buy you at least 5 years of symptom relief.
And tell us about your feedback from patients who've been treated with Rezum.
I've done a lot of these in my practice, and results have been really remarkable.
Now, if BPH goes untreated, can it lead to more serious issues?
Yeah, most of the time BPH is just nuisance symptoms, really bothering you a lot, but it can lead, if it progresses, to recurrent infections in your urine, bladder stones, problems with your kidneys, or even urinary retention where the bladder gets completely blocked.
Who might benefit from this treatment?
Like any man who we determine is the prostate is enlarged is a candidate. Whether he's on medications, is not satisfied with the medications, or somebody who's newly diagnosed with urine problems that are related to a big prostate, they're a candidate for Rezum.
And just how fast could a patient see results and feel relief?
Lots of men start to experience significant relief after 2 weeks of treatment.
Is Rezum covered by insurance?
Rezum is covered by Medicare and most private insurers.
And it also comes down to a quality of life issue.
Yeah, I mean, a lot of my patients, urinating controls their life, and it shouldn't. You know, we've got lots of treatments to improve that. So anyone out there who's suffering, see your urologist.
To learn more about Rezum water vapor therapy and to find a doctor near you, visit Rezum.com. Dr. Simon, we thank you so much for sharing this promising advancement in men's health.
Thank you for having me.
And we thank you for joining us on San Diego Living. We'll see you next time.